Potential barriers to oral health care. Accessibility. Financial. One-fourth of the older adult population has an inadequate income level. Percentages are higher for women, ethnic minorities, and single heads of household. Between 65% and 85% of disabled persons live near the poverty level. Medicaid coverage for oral health care is extremely variable across states and often does not cover older adult care. Medical and pharmaceutical expenses for many persons with disabilities consume a major portion of their income. Many individuals with special needs who have limited income cannot afford standard private practice fees for dental care, have no health insurance, or are underinsured. Transportation and geography. More than 50% of disabled and older adult population live in urban settings. The remainder live in small rural communities or on farms. Public transportation is often unreliable, confusing, unaffordable, or non-existent. Clients with special care needs often rely on others for transportation to dental appointments, which increases their dependence and makes scheduling and compliance difficult. Homebound, hospitalized, or institutionalized clients frequently cannot be transported for care in the community. Physical facilities. Minimum standards for accessibility must be met by dentists according to the Americans with Disabilities Act of 1993. External barriers including parking lots and spaces, walkways, curbs, stairs, narrow doors and entryways, heavy or pressurized doors, and small print signs. Internal barriers include narrow passageways or doors, cluttered rooms or hallways, loose rugs or heavy shag carpets, abrupt changes in floor textures, and bathrooms without grab bars or other modifications. Psychosocial concerns. More than 50% of persons in the United States express positive attitudes toward older adults and persons with disabilities, and yet most really perceive these populations as different and inferior. Society perceives disabilities, differences, and disease states before recognizing similarities. Feelings of guilt, anxiety, apathy, inadequacy, embarrassment, depression, anger, and resentment about special needs interfere with attempts to seek care. Fear of or inability to comprehend dental procedures, antisocial or atypical behavior, or dependency on oral health care providers interferes with provision of care. Basic daily needs and activities are often overwhelming and can lower the priorities for oral health care. Perception of self-image and worth can affect care planning. Provider philosophy and provision of care. The Americans with Disabilities Act requires that public and private dental offices serve persons with disabilities, that treatment is provided on the same basis as the non-disabled persons, and that dentists make reasonable modifications to facilitate access. Despite the Americans with Disabilities Act, surveys indicate some dentists are unwilling to treat persons who are physically or mentally challenged. Reasons given for not treating individuals with special needs include inadequate facilities and equipment, inadequate training, knowledge, and competencies, not wanting to expose normal clients to special clients, inability to collect adequate fees, additional effort and time required, personal discomfort about perceived differences of special clients, treatment of medically complex persons increases insurance premiums. Communication and cultural concerns. Sensory impairments, hearing, visual, limit the client's ability to transmit and receive communications when scheduling or undergoing oral care or participating in oral health care education. The use of technical terminology or an inadequate language level may interfere with understanding. Differences in communication styles, eye contact, physical proximity in contact, formal versus informal speech, cultural variations, use of nonverbal cues and verbal language can impair effective communication. Use of condescending voice tones or language levels closes off communication lines. Foreign language barrier may deter a client for seeking care or reduce effectiveness of care. Inadequate numbers of healthcare providers possesses cross-cultural competence. Medical concerns. Situations compromising the provider or client. Inadequate infection control procedures. Inadequate or inaccurate health histories, inadequate precautions for potential emergencies, inadequate knowledge or systemic conditions and their treatments. Mobility, instability, concerns. Impaired ambulation or use of assistive devices may hinder access to care. Uncontrolled or sudden movements may interfere with home care or dental hygiene interventions. Uncontrolled or aggressive behavior may endanger the care providers and the client. Spatial disorientation may interfere with the client relaxation in the dental chair or with oral care procedures.